This experience has pretty much changed my life. I'm not the same person that I was when I first moved to New York. I realized what exactly I wanted to do with my life.
This was my first time being in an American education system, but I found that, if I was able to find people in my community, I could be successful.
I moved here not knowing anybody at all, but the people here have made me feel welcome, like as if I'm at home.
I was able to break the expectations that everyone had for me, and I was able to make my own expectations.
NYU was my dream school when I applied. When I got in, I remember that day I was screaming down my work hallway, and I'm still hyped about it. I'm so blessed to be here and be able to graduate from this institution.
My favorite professor was Mary Beck. She helped me realize just how deep my love for public health is.
I took health policy with Dr. Wilson Wang, my experiential learning experience with Dean Julia Vina. Those are the two classes that stepped outside of the classroom and taught me how to explore the world around me and how to deal with problems that pertain to people, communities, and what I actually want to do, which is to be a doctor.
Dr. Melody Goodman was one of my favorites. You will see 23-year-olds running to the board to get points.
Professor Daniel Ampad, she would make us dance to Zumba right before the class, every class, and she made EPI so interesting and so much fun.
Dr. Niyati Pare, she's actually been my mentor since my time here. Dr. Andrea Derlin, she's also my thesis advisor. Thank you so much to both of y'all. I really owe this journey to both of y'all.
Reality is that finishing my PhD has fundamentally changed my life. It's challenged me to grow and to come out of my shell, and has brought me the self-confidence that I didn't have before, that I definitely do now, and there's no going back, which is a really nice thing to have and to know will always be mine.
I was a program assistant for NYC Health and Hospitals.
The Center for Health Identity, Behavior, and Prevention Studies, also known as CHIPS.
And Mahati Vajalas, Dr. Nayoras, and Dr. Abrams Tobacco Research Lab.
Nearest and dearest to my heart was my involvement with the communications team. It gave me an opportunity to tell stories of my peers.
I've also had an internship with the Mayor's Office of Labor Relations, Workwell NYC, where I've been able to develop and implement programs.
I had the opportunity to co-found GPH's first healthcare management club, where we bridge the gap between the classroom and real-life practical experience for healthcare management in multiple fields.
This year we started the Justice Initiative. We're an organization that was dedicated to addressing mass incarceration as a public health epidemic.
I co-founded Nutrition Without Borders, which was GPH's first nutrition club.
I was involved in NYU Peer Health Exchange. It's a nonprofit where we go into under-resourced high schools. We provide health education to students who otherwise wouldn't receive it.
I did my internship at the Department of Health and Mental Hygiene in the Bureau of Maternal Infant Reproductive Health, and that was a great experience to get exposure to how the city thinks about public health.
Something that I'm not going to miss at all is the assignments due over the weekend, so I'm going to be happy that I have the Sundays to myself now.
I'm not going to miss standing in lines, waiting for my coffee, being jam-packed in an elevator for class.
Waiting in line forever at the Bopes Library for the printer.
Battle of the freezing wind, walking to class down University Place.
And I'm not going to miss the cold. I'm a Southern girl. I'm over the cold. I'm out of here. I'm sorry.
I think the experience at NYU meant being a global citizen. You meet so many different people from so many different countries, and speaking to those different people, I felt like I visited each country.
When you put yourself in the public health realm, you start to change your perspective on the idea of traveling. So it's not just for fun, it's more so I want to go out and explore and get to learn about different cultures, get to talk to actually people who live there.
This experience at NYU was an opportunity to really step outside your comfort zone and really just grow as a person.
The opportunity that NYU provided of actually going to another country to work with an organization as a consultant, it dropped me in a situation that helped me realize this is where I need to be.
Just be focused in what you want to work with. Be passionate in what you want to work with, have a genuine commitment to upholding human rights, and whether it's working with migrants or working with children or working with any other faction of society, health is an essential human right.
This experience meant growing up, it meant moving forward. So I really want to work nationally and internationally, implementing different policies and intervention plans.
I want to make sure that low and middle income countries have equitable healthcare systems.
It's so important that, we have young people like myself, not just looking to make money, but looking to change one life, looking to ensure that, people are not dying because they're looking for something better.
We got to be on the ground for 2 weeks and we did a bunch of field work. That was my first time really interacting with the community. And I felt like our research is going to actually make an impact. And having that ability to do as a student was really special.
It's something that I don't think a lot of people even realize we need. A lot of the stories that I would hear growing up, I always used to think, why wasn't there something in place to prevent that?
This experience at NYU meant learning inside and outside the classroom, not just from professors and faculty, but also from my classmates.
I'd like to make an impact by improving nutrition in mothers and infants in low-income communities and working towards zero hunger.
That is my goal, to make sure I apply all the skills that I have as a physician, as a researcher, as a data analyst, to be able to prevent child mortality. I am really going to miss NYU, and I actually don't want to graduate. I'm dreading it because I love it so much.
I am going to miss, I call it the 2 F's, food and friends. That's what I'm going to miss the most.
I think I'm going to miss the people the most. I think the people make the experience meaningful.
I'm definitely going to mostly miss my classmates and being together every week in the trenches.
And what I'm going to miss is all the people that I've met, all my friends, my support group. I'll miss New York pizza, Cart coffee, Cart food, Dunkin' Donuts.
I'm actually going to kind of miss being a student, like having the routine and meeting new people all the time and learning new things all the time.
I'm going to really miss 726 Broadway. It's like a nice in-between work and class and just getting to hang out.
The impact that I want to have in this world is to help minority populations and help migrants, asylum seekers, and refugees across the world.
I want to grow the growing trend of strategic public-private partnerships in public health to increase our impact, extend our outreach, and improve health outcomes.
I hope to work on using technology to advance public health, so connecting patients to providers or communities to resources and services.
Provide solutions where the healthcare is not so expensive for vulnerable populations.
Eventually, I do want to focus all of my efforts into our chronic disease epidemic. I think that it's a problem that's going to continue to grow, especially as countries begin to develop all over the world.
Class of 2018, I'd like to offer you a couple of words of wisdom from the social and behavioral sciences. In order to maximize your potential, you need 4 capitals, and we're hoping that you're leaving NYU with these capitals. Human capital, which is what you know and what you could do. Economic capital, what you and your value is in society. Political capital, the knowledge that you can make change and affect it at whatever level you're operating. And the most important, social capital. Look around you, look on the stage. All of these connections are your social capital. So keep in touch, and good luck.
On behalf of the Department of Biostatistics, I would like to say congratulations to the College of Global Public Health, class of 2018. I hope you have a future that's filled with great quantitative data and lots of analyses. I'm excited to see what you do out in the world to make a change in public health.
Be as kind as you can to your peers and others around you. Surround yourself with wonderful people, and as you rise as leaders, ensure that you're working along with others to see their success as well.
On behalf of the Department of Public Health Policy and Management, congratulations, class of 2018. Now that you have finished, think big, change the world. Congratulations.
Congratulations, epidemiology graduates, graduates of the cross-continental program, to all of the graduates who were with me in London, in Ghana, in Florence, and of course, all of the graduates of the College of Global Public Health. Be passionate. There's many challenges in global public health, many frustrations, many barriers. Your passion will get you through.
From the Center for Bioethics, congratulations to the class of 2018. As you go forth in your public health careers, you're going to face a number of complex moral situations. Remember to always do the right thing, even when it's difficult.
Class of 2018, thank you. You're a wonderful, odd, beautiful group of people.
I have to give shout outs to Doye, Yatunde.
Shout out to my mom, my dad, my homies, my squad. You know who you are. I love y'all. We made it. Woo!
Shout out to my Nigerian crew. Shout out to my Middle Eastern crew. Shout out to everyone. We made it. We all went to NYU. This is an awesome school. When you're doubting yourself, just go back and say, I went to NYU.
Shout out to all of the amazing women that I've met throughout my time here at NYU. I'm so grateful to have met all of these women who truly teach me what it means to be a leader in this world.
Also, to all of the students I've had over the 2.5 years that I've been teaching here, they've challenged me to grow and to think about things in a new and different and exciting and young way, which is really, really important.
My grandmother, Nani. Hello, I love you so much. Nani has been my biggest support system.
But most importantly, my mom, I love you.
All of it has been worth it and that you've succeeded. So be proud of yourself. Congratulate yourself for that because you've earned it 1,000%.
As a collective, we're phenomenal. We're a force to be reckoned with. We are just amazing.
Shout out to my family, my support group, my friends, my roommate. I believe that each and every one of us have what it takes to make a difference in this world.
To my classmates, keep in touch. I'm excited to see where you guys land.
College of Global Public Health Class of 2018, we are so proud of you. As you begin the next stage of your academic and professional journeys, let the words carried on the university seal guide your heart and steady your hands. Persevere and excel. Congratulations.